The NIHR, which is the National Institute for Health Research, is the nation's largest funder of health and care research. The ARC, which is the Applied Research Collaboration, supports applied health and care research that meets the needs of local populations. The NIHR ARC for Greater Manchester is one of 15 ARCs across England. ARC-GM's research is based around 7 research themes, which reflects specific priorities for Greater Manchester. Public community involvement and engagement cross-cuts those themes. The Greater Manchester Public Community Involvement Engagement Forum is a network of people across Greater Manchester that link into organisations across GM that can come together, share learning and support best practice. They work at grassroots with public community members across Greater Manchester. We have a public contributor panel, PCIE panel, which brings together local people from different social, economic and cultural backgrounds.
What we talk about is ideas that people have got for projects within the health service in order to try and make sure that the research is as communal and as inclusive as it can be, so that it will give the biggest impact and the biggest progress in terms of health for the people of Greater Manchester.
If we're looking at developing the health of our populations, we need to be looking at the right questions. We need to be looking at what the public wants.
Involving public contributors as part of research means that people who use mental health services or who are carers of people who use mental health services have a voice within the research project. So that means that they attend research team meetings, they get involved in planning some of the research events that we have and have looked to plan. And as well as that, they've been involved in reading through participant information sheets, reading through some of the data and being a part of those conversations in what data and results from the research actually means and looks like to them. So it's really important to get that research voice, especially from the people that use the services themselves and have that first-hand experiences of what mental health services means to them.
It's one thing having a voice, but at the other end, it's about making sure something's done about it.
I've observed with the ARC that public contributors are often involved from the funding application stage, and I think this is a really good example of how to involve public contributors early and not as an add-on at the end where nothing really can be changed.
Through being involved with the PCIE panel and ARC, I've been able to get involved with a wider project at a university, and that's been brilliant working with those researchers. I've been able to see things that they missed, because academics think in a certain way. Then getting that patient public perspective is really valuable to them.
I think we've certainly seen that the projects have evolved and adapted as a result of the discussions that have taken place.
Public contributors help us draft our strategic goals and our principles, and they help us to ensure that our research meets the needs of our local population.
As a public contributor and the team we work with, where we share our knowledge and expertise, the 5 key goals for our organisation or our group is to maximise diversity and inclusion, to develop collaborative approaches with Greater Manchester, develop effective approaches to support each other, learn from our best practices and continuous evaluation.
Greater Manchester has a widely diverse population, so it's really important that we get those voices heard within the research that we do within ARC. And it's really important that those voices are heard at all levels.
Main things about our panel is that we're a very diverse group of people. We have very different backgrounds. We all belong to different communities.
There's people from all walks of life that I might not otherwise have met. And there's people with all different health conditions from all different sorts of communities within Greater Manchester. And I think that, there's a great diversity there.
I firsthand experienced the challenges of a label, the stigma, and how services are altered and where inequalities are invisible.
We have our own networks and groups and people that trust us, and we act like as a sort of membrane to kind of reach out to people that are often called hard to reach, but they're not. They just need people that they can trust.
For me specifically, as a Black researcher, it was really important that Black voices were heard through one of the projects that I did. And I made sure to specifically think about the best ways to involve that group. So for one of the discussion groups that we did, it was really thinking about what is the best time for people within that wider network and group who are from the Black community. What are the best kind of times and spaces that would really suit that group?
The research that I participated in with this group has allowed me to engage with the community and allow them to feel valued. I'll give you a statement, some of the ladies I interviewed with. I can't believe somebody's taken the time to listen to me. They had comments like, I actually feel valued, I feel like I matter.
For me and many others, attending meetings as a public contributor isn't work. It's like being amongst friends, and we don't do this as a job. We do this because we care about making a positive impact in research activities.
I'm passionate about having a voice and making sure people's voices are really heard. And if they're not, I think the panel has no hesitation in saying.
What we do is not hard work, it's heart work.